Hey guys, so today I'm going to be talking about an illness in hamsters, which is quite common, especially in younger hamsters, and that is wet tail. Now, wet tail is a bacterial infection spread when a hamster comes into contact with contaminated food or water, or caused by an imbalance of the natural bacteria in a hamster's digestive system. Only Syrian hamsters are susceptible, not dwarfs, although dwarf hamsters can suffer from diarrhea, which is sometimes mistaken for wet tail. Syrian hamsters can also suffer from diarrhea without having wet tail, so the two are often confused with one another. Syrian hamsters under 12 weeks old are more likely to get wet tail, especially those at 4 weeks old when they are being weaned. Another vulnerable time is when they are being moved, most likely to a new home. This is why you should avoid handling new hamsters for at least 24 to 48 hours after bringing them home to let them settle in. The main cause of wet tail is stress, such as stress caused by weaning, transportation, and overcrowded living conditions. With this in mind, all hamsters are different and they each have different stress tolerances. Some say that wet tail is caused by unsanitary living conditions, but this is not true, although unsanitary living conditions can lead to stress. It is also believed by some that wet tail susceptibility can be genetically inherited, although this isn't known for sure. The main symptom of wet tail is severe diarrhea, but others include lethargy, loss of appetite, failure to groom, unusual irritability, dehydration, and in severe cases, blood or mucus can be seen in the feces. Symptoms will start to show 7 days after being infected, and death can occur as little as 24 to 48 hours later. Be aware that wet tail can cause rectal prolapse, where the rectum is pushed out of the body. If this happens, immediate veterinarian care is necessary. The best thing you can do if you think your hamster might have wet tail is take them to the vet immediately, where an antibiotic such as Baytril will be prescribed, hopefully as well as an antidiarrheal medication and something to rehydrate your hamster. Supplementing antibiotics with plain yogurt is also important to keep the digestive system balanced, and keeping your hamster hydrated using Pedialyte mixed with water or Oxbow Critical Care, which you can feed with a syringe, is important to replenish fluids in your hamster to prevent dehydration. You will also want to keep your hamster in a warm and quiet environment while they recover, and keep handling your hamster to a minimum and to lower stress as much as possible. There isn't a way to absolutely prevent your hamster from getting wet tail, but lowering stress as much as possible in your hamster's life and providing a quiet, safe, and clean environment will make your hamster less susceptible. Try not to handle your hamster much after the first few days of bringing them home, and don't do full cage cleanups too often, as this takes away the familiar smell, leading to rescenting of everything by your hamster. Always leave a bit of old bedding in your hamster's cage so their familiar scent is still there. When switching foods, it is important to keep this in mind, so be sure to gradually switch your hamster's food. Doing this suddenly will result in a stressed hamster, increasing the chance of wet tail and other illnesses. As long as you care for your hamster properly, do your research, and provide a safe, clean enclosure, your hamster should stay healthy and you shouldn't have anything to worry about. If this video helped you in any way, feel free to leave a comment, like, or subscribe for more. See you guys soon. Bye!